Heat stroke is a serious medical emergency. It occurs when the body's temperature rises rapidly above 104 degrees Fahrenheit or 40 degrees Celsius. This happens when the body's cooling mechanisms fail, and it can't control its temperature. Heat stroke can be fatal if not treated immediately. Heat stroke is a major health concern, especially during the summer months. It is often referred to as a silent killer because its symptoms can sometimes be mistaken for other conditions. Understanding the dangers of heat stroke and knowing how to prevent it is crucial for everyone. It's important to be aware of the factors that can lead to heat stroke. Prolonged exposure to high temperatures, strenuous physical activity, and dehydration are some of the most common triggers. Certain medications and underlying health conditions can also increase a person's susceptibility to heat stroke. Taking preventive measures is the best way to avoid heat stroke. Staying hydrated, wearing lightweight clothing, and avoiding strenuous activity during the hottest parts of the day can significantly reduce your risk. Remember, heat stroke is a preventable condition, and being informed is the first step towards staying safe. Knowing the symptoms of heat stroke is crucial. Early recognition can make all the difference in preventing life-threatening complications. The primary sign of heat stroke is an extremely high body temperature, often exceeding 104 degrees Fahrenheit or 40 degrees Celsius. Other common symptoms include a rapid and strong pulse, throbbing headache, dizziness, nausea, confusion, and even seizures. In some cases, individuals suffering from heat stroke may stop sweating altogether, which is a particularly dangerous sign. If you or someone around you experiences any of these symptoms, especially in a hot environment, it's essential to seek immediate medical attention. Time is of the essence when it comes to heat stroke, and prompt treatment is vital for a positive outcome. Remember, these symptoms should never be ignored, and delaying treatment can lead to serious consequences. Stay vigilant, especially during hot weather, and be prepared to act quickly if you suspect heat stroke. Understanding the difference between heat exhaustion and heat stroke is crucial. Heat exhaustion is a milder form of heat-related illness, but it can progress to heat stroke if left untreated. Both conditions share some similarities, making it essential to recognize the distinctions. The main difference lies in the severity of symptoms. Heat exhaustion typically involves heavy sweating, muscle cramps, fatigue, headache, dizziness, and nausea. Heat stroke, on the other hand, presents with a much higher body temperature, often above 104 degrees Fahrenheit, and is accompanied by more severe neurological symptoms such as confusion, seizures, and even loss of consciousness. While heat exhaustion can often be managed with simple measures like rest, hydration, and cooling down, heat stroke requires immediate medical attention. Recognizing the signs and knowing when to seek help can be life-saving. Remember, if you suspect heat stroke, do not hesitate to call emergency services. Prompt medical intervention is crucial for preventing potentially fatal complications. If you suspect someone is experiencing heat stroke, immediate action is crucial. First and foremost, call 911 or your local emergency number to get professional help on the way. While waiting for medical professionals to arrive, there are several steps you can take to provide first aid. Move the individual to a cooler environment, preferably an air-conditioned space. If this isn't possible, find a shaded area and try to create a breeze. Remove any unnecessary clothing to help the body cool down faster. Next, begin cooling the person down by any means possible. Apply cool water to their skin using a sponge or cloth. If ice packs are available, wrap them in a towel and apply them to the person's armpits, groin, neck, and back, areas where blood vessels are close to the surface. Continue these cooling measures until medical help arrives. Remember, time is of the essence when it comes to heat stroke, and your quick actions can make a significant difference in the outcome.